The PT and aPTT test is often misunderstood as a warning sign or a signal that something has gone wrong, but in reality, it is an instrument of awareness rather than fear. It exists to observe the body, not to alarm it. When doctors recommend this test, they are not predicting illness. They are listening to timing, balance, and coordination inside the blood. These tests measure how smoothly the body moves between protection and openness, how it decides when to clot and when to keep blood flowing freely. This is not a judgment of health, but a snapshot of an ongoing process that has been working silently since birth. For many older adults, the moment a blood test is mentioned can trigger anxiety because numbers feel final and unfamiliar terms feel intimidating. Yet, PT and aPTT values are not labels placed on a person. They are signals that help guide understanding. Just as a clock helps us know when to rest or when to act, these tests help clinicians understand whether the internal timing of clotting is aligned with the body's needs. Awareness replaces uncertainty, and with awareness comes calm decision-making rather than emotional reaction. What makes this awareness powerful is that it creates space for prevention. A slight change in clotting time does not automatically mean disease, but it may highlight the influence of nutrition, medications, hydration, or liver function. Instead of waiting for symptoms to appear, the PT-aPTT test offers an early conversation with the body. It allows care to begin gently through small adjustments rather than urgent intervention. This shift from reaction to prevention is especially important as the body ages and becomes more sensitive to internal imbalances. Understanding this test also changes the way older adults relate to their health. Rather than feeling passive or dependent, they become informed participants. Knowing that these results are guides rather than verdicts encourages questions, dialogue, and collaboration with healthcare providers. It reminds individuals that health is not something that suddenly disappears, but something that can be supported through informed choices and mindful living. At a deeper level, the PT and aPTT tests reveal how intelligent the human body truly is. Blood does not clot randomly, it responds to precise biochemical signals designed to protect life. When we measure clotting time, we are witnessing the body's wisdom in action. Even when results fall outside the ideal range, they are expressions of adaptation, not failure. They show where support is needed, not where hope should end. When fear is removed from the equation, clarity takes its place. The PT-aPTT test becomes a tool for reassurance as much as for diagnosis. Normal results confirm stability, while abnormal ones invite thoughtful attention rather than panic. This mindset is crucial for older adults who benefit most from steady, informed care rather than sudden emotional stress. Ultimately, awareness is the foundation of empowerment. The PT-aPTT test offers insight into an essential life-preserving system, allowing individuals to understand their bodies with respect rather than suspicion. When viewed through this lens, the test is no longer something to dread, but something that strengthens the relationship between science, medicine, and the individual's sense of control over their own well-being. Healthy blood function does not exist in isolation. It is shaped quietly and consistently by the choices made every day, especially at the dining table. The nutrients we consume become the raw materials from which the body builds and maintains the delicate systems that regulate clotting and circulation. When a PT-aPTT test reflects balanced timing, it often mirrors a pattern of nourishment that supports harmony within the blood. This connection reminds us that food is not merely fuel, but information that guides how the body behaves at a molecular level. A diet rich in natural, unprocessed foods supports the body's internal rhythm in subtle but powerful ways. Leafy green vegetables contribute essential compounds that help regulate clotting mechanisms, while colorful fruits supply antioxidants that protect blood vessels from inflammation and oxidative stress. Lean sources of protein provide amino acids needed for the production and repair of vital blood components. Even healthy fats play a role, supporting flexible blood vessels and smooth circulation. These elements work together quietly, reinforcing the systems measured by PT and aPTT without dramatic intervention. Hydration is another often overlooked contributor to healthy blood behavior. Blood that is adequately hydrated flows more smoothly, reducing unnecessary strain on the heart and vessels. Mild dehydration, common among older adults, can subtly thicken blood and influence circulation over time. Simple habits, such as drinking water regularly throughout the day, can support more stable internal conditions, helping the body maintain balance without effort or complexity. What makes nutrition especially powerful is its cumulative effect. One healthy meal may not change a test result overnight, but consistent nourishment builds resilience over weeks, months, and years. This long-term support is particularly valuable for older adults, whose bodies respond best to steady, gentle care rather than sudden extremes. Balanced eating patterns help stabilize energy levels, support organ function, and reduce unnecessary stress on the systems involved in clotting. Healthy blood function is also influenced by how food choices interact with medications. Certain nutrients can support or interfere with prescribed treatments, making mindful eating an important part of coordinated care. Awareness of this relationship encourages individuals to approach diet not as a restriction, but as a partnership with medical guidance. This sense of collaboration replaces confusion with confidence and helps individuals feel more in control of their health journey. In this way, healthy blood function becomes a reflection of daily care rather than a mystery revealed only by laboratory tests. The PT-aPTT test then serves as confirmation of patterns already in motion, offering insight into how well the body is being supported from within. Through consistent, nourishing choices, individuals reinforce the body's natural intelligence and strengthen the internal balance that sustains vitality with age. Movement is one of the most powerful ways to support healthy blood function and overall vitality, especially for older adults. Light, consistent exercise may seem simple, even modest, but its effects ripple through the body in ways that profoundly influence circulation, clotting balance, and long-term well-being. Every step taken, every stretch performed, every gentle movement signals to the body that it is needed, valued, and alive, reinforcing systems that PT and aPTT tests are designed to measure. Circulation is not just about pumping blood. It is about delivering nutrients, clearing waste, and maintaining the delicate timing of clotting and fluid balance that sustains life. Even gentle forms of exercise, such as walking, yoga, tai chi, or low-resistance strength training, stimulate blood flow throughout the body. Increased circulation ensures that oxygen and nutrients reach tissues efficiently, while supporting the dynamic balance between clotting and fluidity. When the body moves regularly, platelets and clotting proteins are less likely to form inappropriate clots, and vessels remain flexible and responsive. Movement also encourages the heart, lungs, and muscles to work in harmony, reinforcing the interconnected systems that maintain health quietly in the background. Consistency is far more important than intensity, particularly for older adults. Pushing too hard can introduce stress and strain, but gentle, repeated movement becomes a form of internal coaching, reminding the body of its own resilience. Over time, regular activity strengthens blood vessels, improves circulation, and helps the body respond more efficiently to minor injuries or internal disruptions. Even small daily routines, like a short walk in the morning or gentle stretches before bed, accumulate benefits that are reflected in lab measures like PT and aPTT, translating lifestyle choices into tangible support for internal systems. Movement also interacts with other lifestyle habits to amplify its benefits. Exercise improves sleep quality, which in turn supports hormonal balance and tissue repair. It reduces stress by calming the nervous system and lowering inflammation, both of which are crucial for maintaining healthy clotting function. Physical activity encourages mindful awareness of the body, helping older adults notice subtle changes and respond proactively rather than reactively. This awareness fosters confidence, empowerment, and a sense of agency, reminding individuals that age does not mean stagnation or helplessness. When older adults incorporate movement into daily life, it becomes a statement of vitality and intention, a declaration that the body is worth care, attention, and respect. That attitude alone influences health, reducing stress-related hormones that can interfere with circulation and clotting, and promoting a calmer, more resilient internal environment. Exercise also strengthens social and environmental connections, which indirectly support internal balance. Walking with friends, joining gentle group classes, or simply being outdoors encourages engagement and joy, reducing the isolation that can negatively affect mental and physical health. The benefits extend beyond the cardiovascular system, reaching the nervous system, immune system, and overall metabolic function, all of which subtly contribute to the factors measured by PT and aPTT tests. Ultimately, consistent, gentle movement is a declaration of ongoing care for the body. It supports blood health, strengthens circulation, and maintains the body's natural timing mechanisms, all while fostering confidence, awareness, and a positive outlook. Through regular activity, older adults can reinforce internal balance, support resilience, and translate mindful action into long-term vitality, creating a life where laboratory numbers reflect not just biology, but a lived commitment to well-being. Lifestyle habits shape health in ways that are often invisible, yet profoundly influential, quietly supporting the internal systems that PT and aPTT tests measure. The body is a network of interconnected processes, and choices around sleep, stress, and daily routines directly affect circulation, clotting balance, and overall vitality. For older adults, cultivating supportive habits becomes even more crucial because the body's resilience naturally changes with age, and the margin for imbalance can be narrower. Simple, consistent practices can reinforce the body's intelligence and maintain internal harmony without dramatic interventions. Quality sleep is one of the most powerful lifestyle factors influencing blood and overall health. During rest, the body repairs tissues, regulates hormones, and maintains internal systems, including those involved in clotting. Inadequate or fragmented sleep can subtly disrupt these processes, affecting platelet function, circulation, and the timing of clotting cascades. Establishing a sleep routine that aligns with natural rhythms, creating a calm environment, and allowing for sufficient rest can strengthen the body's balance from the inside out. Sleep becomes not just recovery, but an active participant in preserving health and vitality. Managing stress is equally important for maintaining internal balance. Chronic stress activates the nervous system in ways that can constrict blood vessels, increase inflammation, and disrupt clotting factors, all of which are reflected in PT and aPTT measurements. Techniques such as deep breathing, meditation, gentle movement, or even simple reflection and mindfulness allow the nervous system to reset and support natural equilibrium. A calm mind fosters a calm body, reminding older adults that emotional well-being is as integral to circulation and clotting as nutrition or exercise. Avoiding harmful substances like tobacco and limiting excessive alcohol intake is another vital lifestyle consideration. Smoking introduces toxins that stiffen blood vessels and impair circulation, while alcohol can influence liver function, which plays a central role in producing clotting factors. These lifestyle choices may seem small, but over time, they create measurable differences in the body's ability to maintain balance. The body responds to consistent care, and the decisions made today can support systems measured by PT and aPTT tests for years to come. Hydration, although often overlooked, plays a key role in lifestyle support. Water helps maintain proper blood volume and fluid balance, ensuring that circulation is smooth and efficient. Proper hydration allows clotting factors to move effectively and supports vessel flexibility, reinforcing the quiet work that the body performs every day. Even simple habits like drinking water at regular intervals, choosing hydrating foods, and paying attention to thirst signals can strengthen internal balance over time. Lifestyle habits also extend to daily movement and social engagement. Engaging in light physical activity, maintaining routines, and connecting with others reduce isolation and promote mental resilience, which indirectly influences blood health and internal timing systems. The interconnectedness of lifestyle, emotional state, and physical function highlights the holistic nature of well-being. By cultivating habits that nurture body and mind, older adults create conditions where PT and aPTT results are reflections of ongoing care rather than sudden interventions. Ultimately, lifestyle choices are a form of daily dialogue with the body. Each habit, from sleep patterns to stress management to substance moderation, communicates respect and attentiveness, supporting the complex internal systems that sustain life. These decisions accumulate quietly, producing profound effects over time and offering a practical, empowering way for older adults to maintain vitality, resilience, and harmony. A positive mindset is one of the most powerful, yet often underestimated, tools for maintaining health, particularly as we age. It shapes how we approach every aspect of our lives, from the food we eat to the movement we choose, to the ways we respond to medical guidance, such as PT and aPTT tests. When older adults cultivate optimism, hope, and self-compassion, they are not just improving mental well-being, they are actively influencing physiological processes that support circulation, clotting balance, and overall resilience. The way we think about our bodies and our health has a direct relationship with how the body responds, adapts, and thrives. A positive mindset encourages consistency and engagement with healthy habits. When we believe that our choices matter, we are more likely to eat nourishing foods, stay hydrated, and engage in gentle physical activity. Each of these actions reinforces the systems that PT and aPTT tests measure, creating a feedback loop where intention, action, and biological response strengthen one another. Optimism transforms routines from obligations into acts of care, making healthy behaviors sustainable and enjoyable rather than stressful or burdensome. Beyond supporting physical health, a positive mindset reduces stress, which has profound effects on blood and circulation. Chronic stress triggers hormonal and inflammatory changes that can subtly affect clotting, vessel flexibility, and overall cardiovascular function. When older adults practice gratitude, mindfulness, or simple mental reframing, they help calm the nervous system, lower stress-related chemicals, and create an internal environment that supports balance and resilience. This calmness allows the body to perform its natural protective work more efficiently and ensures that clotting mechanisms respond appropriately when needed. Optimism also empowers older adults to approach medical testing with curiosity rather than fear. PT and aPTT tests become a source of insight rather than anxiety, a way to listen to the body and respond with informed choices. Viewing results as information instead of judgment fosters proactive engagement, where lifestyle adjustments, dietary improvements, and gentle physical activity are seen as tools of empowerment. This perspective reduces feelings of helplessness and strengthens the psychological connection to physical well-being, making health maintenance a collaborative process between mind and body. The psychological benefits of a positive mindset extend into social and emotional domains as well. Maintaining hope and a constructive outlook encourages connection with friends, family, and community, which indirectly supports circulation, heart health, and overall vitality. Engagement and purpose create motivation to move, eat well, and rest adequately, reinforcing habits that maintain internal balance. The emotional resilience that comes from positivity reduces the impact of setbacks, illness, or laboratory results that may be less than ideal, allowing older adults to respond thoughtfully rather than react impulsively. A positive mindset also nurtures patience and self-compassion, which are essential for sustainable health practices. Improvement in blood health or clotting balance does not happen overnight, and maintaining a supportive lifestyle requires long-term commitment. Believing in the body's capacity to adapt and heal encourages adherence to gentle routines, mindful nutrition, and daily movement, reinforcing the very systems PT and aPTT tests monitor. Mindset transforms care from a set of external rules into an internal motivation, creating a sense of agency and purpose. Ultimately, a positive mindset integrates all aspects of life into a cohesive approach to well-being. It strengthens resilience, supports informed choices, and cultivates harmony between mind, body, and lifestyle. By fostering hope, self-compassion, and constructive thinking, older adults can empower themselves to maintain health, support circulation and clotting balance, and approach each day with confidence and vitality, creating conditions where their bodies thrive as a reflection of the care, attention, and optimism they invest in themselves.